Welcome back to the MTV studio. I'm your host, Jay Pendleton, here with Hayley Hiner, InReach Health. Great to see you again.
Yes, thanks for having me back. I appreciate it.
I love it. We were here at Academy last year.
Yep.
And for those that didn't catch that, maybe catch us up to speed. We're going to talk a little bit more around like who you serve, but I want to set the stage for what it is that you do, kind of for those that didn't see our wonderful conversation last year in San Diego.
Yeah, absolutely. So high level, we partner with rural hospitals. Our mission is to bring elevated access to rural hospitals. How do we keep them alive and not only just alive, but thriving?
Right.
So we were founded by an orthopedic surgeon in 2010. Orthopedics is really, the core of what we do still. We've branched out, but still about 60% of our business. So bringing in specialty services on a permanent but part-time basis from the surgical perspective. So we bring in physicians a minimum of 2 days a month. It's typically a day every other week. We split the day between the clinic and the OR, and then we kind of grow the programs from there. So it's a really great income for the physicians.
Yep.
And it also keeps orthopedic revenue in these rural hospitals, which is really crucial. So It's really, kind of a win-win. The physicians love it.
Right.
And then it's an invaluable resource for these hospitals too.
So unpack that a little bit. Like, what type of physicians are you all partnering with? I know orthopedics is 60%, but like, just who is this for?
Yeah, no, it's a good question. And, from our hospital perspective, from the physician perspective, it's really not a one-size-fits-all program, which is great. We really customize it based on the community, the hospital need, and also the physician capability. So we really can look at what works best for everyone in the situation. So orthopedics, our founder, Dr. Shear, is a general orthopedist. That's the training has kind of gone away from general orthopedics. So we do all subspecialties: spine, hand, foot and ankle, joints, sports, really you name it in ortho. We are always interested in talking to those physicians. And then what kind of orthopedic surgeon? Again, it really depends. Most of our surgeons are primarily employed somewhere else. Mm-hmm. And this they do with us 2 days a month. So it's a great, side job, an additional revenue stream for them. And I think at the end of the day, what becomes most important is they really enjoy it. They're going to places where they're really needed. They're not in a competitive environment, which is what they're used to probably in the urban setting. The patients love that they're there and they're really making a big difference. So, the financials are great too. So it is kind of how can we get everyone to win in this situation?
Do you want to dive into that a little bit?
Yeah. Absolutely. I mean, obviously that's an important piece of it.
Yeah.
And I think initially what draws physicians in, piques their interest is that the financial component is compelling.
Right.
But I think the mission is what keeps them there.
Okay. Yeah.
They're paid. It is a production model. And then we pay a high fair market value rate per RVU. So they have uncapped potential in these markets. And that's part of the big reason why we start small. So at 2 days a month, we know they can be busy at 2 days a month. And then we look at, is there increased bandwidth with that physician? Or is that a great time to bring in a subspecialist that can help take the program to the next level? So again, I think that the financials draw them in, but the mission keeps them there long term.
So tell me, do you have like a success story or something that you wanted to maybe highlight here in orthopedics that would resonate with some of the people that watch this? Like, again, 2 days every month, not a huge, lift on their end, but a significant amount of revenue and really a rewarding work where, again, in that rural area, they're so grateful for the care. But talk maybe, you don't have to name names, but just like specifically like anything that might resonate. Yeah.
I think the biggest thing, the common themes I keep hearing, I talk to these physicians all day long. Lots of them I've known from, different walks of my life. And the stories, though, are the same, is they're getting killed by overhead. They're getting burnt out from that. They're tired of taking call. It's almost unheard of to be in a small private practice anymore. Their practices are getting bought or they're becoming employed. So I think they miss the autonomy and also the income that they were used to 5, 10, 15 years ago.
That's right.
And this model really gives them another outreach, another opportunity, another revenue stream. And I think keeps them to where they are. Whereas often they're looking at, should I leave my group? Is this sustainable in the model I'm in? If we can bring in additional revenue source, then maybe that's a yes. And they don't have to uproot their family from where they're at. You know, I hear that all the time. You know, my kids are still in school. I don't want to move, but I'm not sure I can keep going with the way that, you know, that cuts are with reimbursement and overhead. Those are two of the biggest themes that I hear over and over again. You know, and I think everything in healthcare is cyclical. We see that a lot, but it seems to be a lot of physicians are going to bigger groups, bigger employment, but they miss that private practice feel. So they can go and have that really intimate medical setting of taking care of their patients that I think they really yearn for. And then, of course, again, the financials really help play into that too.
Sure. So just walk that back a little bit. This is for anyone, private practice, employed physicians, right? They can all take part in this.
They can,
outside
you know,
markets.
They really can, as long as, you know, they have the blessing from an employer. But really, we've worked with Kaiser physicians, VA physicians, big employed hospital physicians from these large systems. So, you know, we vet that out early on, of course, but I wouldn't let that be a barrier for anyone, because there is precedent. We've seen it, and especially over the last couple of years, I've seen it more and more that these companies and employers are allowing physicians because they want to keep good physicians, and giving them another outlet is a way to do that.
Oh, for sure. It gives them that ability, like you said, to earn a little bit extra income, to maybe like get back to that like private practice feel where it's fully autonomy. It's very close to the patient, high touch. And not a huge commitment for them. They don't have to uproot their family, but they can still take advantage of, you know, both the monetary as well as, like, I would say maybe the mental, lift.
For sure. And, you know, I think to that point, again, going back to that's not a one size fits all, is that's the majority of the doctors that work with us. This is just on the side. We do have quite a few number of physicians, especially when we expand beyond orthopedics and our specialties, that start at 2 days a month. They're like, man, I love this. And can I do more? And then maybe wind down from another practice to just working with us. So really, it's very open-ended in what the opportunities are. We probably have 5 or 6 orthopedic surgeons that work with us as their primary employer. They work anywhere from 6 to 10 days a month.
Wow.
You know, kind of a week on, a week off type model, and making close to what they were making in a full-time position, if not more. So getting back to these work-life balance conversations and burnout and things that are really pertinent. And we've seen a lot of success with that. You know, when we are looking at a more of full-time schedule with physicians, it is typically going to multiple locations. But again, we're happy to talk to anybody that's interested in what we do to fit what's your need, what are you looking for, what's ours, and where can we find a match.
Love that. So, of course, we're here, orthopedics. It's kind of your where you were born, 60%, but it's not just for orthopedics. So maybe address some of the other specialties, subspecialties that you're placing and that you're managing today. Yeah.
So outside of orthopedics, probably our biggest areas of need is urology is a huge need. ENT, we do a lot of general surgery. And then ophthalmology and GYN are a little bit newer of specialties for us, but we're growing rapidly there as well. But really most specialties that can be done really successfully on an outpatient elective model, you know, we're interested in. So touching on general surgery for a minute, that is one that I think is really, we've seen a lot of traction, is because of that work-life balance. General surgeons can work with us 2 weeks out of the month, and that is a full-time job. And they, again, you don't have to live in these communities. We travel you in, we handle all the travel. You don't have to pay for any of the travel. I think that is a differentiator for us. And again, you're helping these rural communities. And then 2 weeks out of the month, you're at home with your family. It's just a much better work-life balance.
Let me ask you a question. I'm trying to unpack, okay, how do you mirror the need in the rural community with the gaps in their current practice environment? Let's say they have operative days, Monday, Wednesday, half day Friday, with clinic Tuesday, Thursday.
Yep.
How does that work as it relates to the need that you're fitting and their flexibility? I'm just kind of curious how would they carve out time?
Yeah, we sit with them on the front end. I oversee our recruitment, and then we have a great operations team that also meets with all physicians on the front end. We really look at their schedules and assess, what are they doing? Most physicians have kind of an administrative day, areas they can condense, and then to be able to free up 2 days a month for us. So, today's Wednesday, every other Wednesday, for example,
right.
they have either a light day, an admin day. Where can we move this half day and this half day to make these 2 days? And even the busiest physician in, Denver, Chicago, Boston, wherever it may be, we find there's room in there to consolidate, especially if the reward is there.
Oh, for sure. I mean, they'll make the time with given that reward. And, I love to hear some, those success stories you mentioned around, they get in, they start 2 days a month, they really like it, they increase that, and then, maybe sunset where they even started from. That's a pretty cool. That shows me that there's, that attachment, it's not happening just by random.
Yeah,
That's
no,
awesome.
Absolutely. And our average physician too. So the minimum entry point is 2 days a month, but our average physician does 4 days a month, which is, again, reinforcing that everyone starts at 2 days, but the average physician does 4 because they really enjoy it. Obviously it's rewarding financially and they enjoy doing it. So we have very high physician retention. I get asked the question a lot by physicians too of, is this a staffing firm? What all do you bring to the table later on? So you'd have a dedicated, account manager from InReach that also partners with the hospital for the life of the contract. So we work on your schedule, on the program development. We can help with credentialing and marketing and any of those headaches that you might see. How do we help with the program development? Don't take that back to the OR director and the team. Let us bring it to us, who has done this in many hospitals. We have solutions. So we're that sounding board. We're also that partner. Our fees are production-based, which I think is important for physicians to know that we are equally as invested in the program's success. So we're not sending you to, the middle of Wyoming if we don't think that program can be successful.
Yeah, I love that. No, that's a really important distinction because your goals are aligned.
Yes.
And that's usually means a good partnership, and as you've seen, high retention, success, repeat customers, or clients, I should say, and then these doctors are wanting to do more.
Yes. Yep.
Anything else you want to share while we're sitting here? I think we captured a lot of good things, but I just want to give you the opportunity, Hayley, to share whatever that is.
I just am hopeful that, physicians will hear this and it resonates with them, either about struggles they're facing in their day-to-day lives or, wanting to explore a new opportunity, that, reach out. There's, again, endless opportunity. We're a very innovative company. Even if it's not something that we're doing today or a location that we're in today, we're rapidly growing and expanding. So we'd love to have the dialogue. We'd love to keep you in our pipeline to figure out how can we make this work for everyone, especially if you're in those specialties, orthopedics, general surgery, urology, ENT, ophthalmology. We really always have a need and are always looking for physicians that align with our mission.
Fantastic. If people want to learn more, where do you want to point them? Where's the best place?
The best place is our website, irhealthcare.com.
irhealthcare.com. Wonderful. Well, Hayley, thanks for sitting with us. I know that there will be a lot of surgeons that see this that definitely learn and potentially have a new option for some ancillary, exciting ways to get back to the craft that they love and getting paid adequately to do that. That's a great win-win. So thanks for spending some time with us here in the studio.
Yep. Thanks for having me. Appreciate it.
We'll see ya.
Yeah.